Hey, welcome to Facts at 5. I'm Michael Clark. I'm here at LTV Studios in Wayne Scott with my weekly guest, Town Supervisor Peter Van Scoyoc. Welcome, Peter.
Thank you, Michael. It's good to see you.
Good to see you as well. Hey, some interesting things are happening on the COVID front. The numbers were surging and now appear to be dropping a bit. Long Island's infection rate remains the highest in the state, though, with Suffolk reporting over 1,000 new positive tests earlier this week for a daily positive rate of 8.54%. We're a little bit better now, I think. But nevertheless, those numbers represent a decrease from earlier this month when Suffolk County reported over 2,000 new cases on 4 days and a positive test rate as high as 11%. But despite those numbers, the big news was that Suffolk County Executive Steve Bellone announced on Monday that following the state's lead, that high-risk sports, namely boys and girls basketball, wrestling, competitive cheerleading, could begin a foreshortened season on Monday, should the various school districts agree, as reported by the East Hampton Star. Now, I know that that's not your decision, Peter, but I was just wondering, what's your take on this? Because to me, I guess the big question is the timing on this at all debatable now, with the numbers being where it is? But what's your take?
So I think, just the idea of high risk, attached to that raises eyebrows and red flags and questions. And I think it's important to understand that there's also very high risk right now for, I think, suicide, for severe depression being experienced by kids without the ability to socialize and exercise to relieve some of that anxiety and stress. We know that team sports is a good outlet to do that. There are concerns about substance abuse too. This is a very difficult time for everyone, and we want to make sure that our most precious resource, which is the next generation, is well cared for. And I think that some of what we've learned is that the school setting actually has a 37% lower rate of transmission than the general public. So that, when kids are out and about anywhere else, they're 37% more likely to get, the disease than in school. So I think, this is a really an important step. We have tried since the beginning of the pandemic to walk a very fine line between protecting exposure in people's health, maintaining people's incomes by trying to keep places of business open in a safe manner. We've been trying to keep our schools open in a safe manner. And because it's really important, I think, to try to reach some sense of normalcy. But again, it's a fine line to walk. I think it probably is the appropriate thing to do at this point. As you mentioned at the onset, we were almost 12% positive rates coming in at the peak of the surge. The last number I saw was something like 7.1% came in yesterday from the county. So and 35% reduction nationwide in the number of positives in the last couple of weeks. It's been going down, which is great news. That's not to say that we can let up, but and who knows if it'll surge back up again here shortly, after the school breaks and maybe people traveling. But I do think, we have to keep those kids engaged and active and think about their social contact and just general health.
That's a fair point, Peter, and not to leave out the fact that these schools are going to have to put certain protocols into effect anyway to make this happen, right? I mean, there's testing that has to be done and all kinds of protocols in the gyms and whatnot.
Right. I think the school's protocols to date are the reason why there's such a low infection rate, transmission rate within schools. And of course, they're going to be taking those protocols very seriously. I have great faith in their ability to protect the students' health. And part of protecting their health is also their mental health, their physical health, beyond just protecting them from the virus. So it has to be multifaceted approach to health.
Right. And I know in other parts of the country, the unions are having a little bit of a problem with it, but that doesn't seem to be an issue here. But onward we go, right? I mean, we take it day by day like anything else that we've been doing for the last year.
Well, and I think our local schools, I mean, in speaking to Rich Burns, I mean, I know that the schools want to be part of the solution here. We're a very small, tight-knit community. I know that there's staff there ready to and willing to volunteer, whether it's administering vaccine, the school nurses, or clerical staff or whatever, to help us with our dedicated vaccination center, which will be at the former CDCH site. We're progressing very well with putting that together.
Great.
And I've had conversations with the county executive, and we think that we will, when vaccine becomes available, that we will be receiving vaccine to give here locally. Right now, there is no vaccine available, very, very limited supplies. That probably won't change in the immediate future, so we're all going to have to be patient. I know everybody wants, most people want to have that vaccine as soon as they get a chance, and those who've got it have told me they feel like they've won the lottery because it's just that hard. The chances are that slim right now of getting it. We just got to keep hanging in there, keep following the safety protocols. So these new variants spread twice as fast as the initial COVID-19 virus, so have to be vigilant.
Yeah, and the good news is also that that you guys have now made the people who need to know that we're ready here in East Hampton. Just give us the goods. We're ready to go.
Absolutely. I thought from the beginning that when we started talking about vaccination, that we'd be better off taking it upon ourselves and putting our own local resources here. We have really tremendous resources, the people of East Hampton, and bringing them to bear on this problem. I know that we'll be able to manage it. It takes the stress and responsibility off the county to put resources towards and staffing towards this. So, we're almost there. I think the physical plant will be ready as early as about February 8th. We've ordered pharmacy grade refrigeration and freezers to be able to take the vaccine. We have healthcare professionals willing and able and lined up. We're taking volunteers from throughout the community. If you have the ability to take on clerical work, help direct traffic, whatever it is, if you call my office, 631-324-4140, we'll get your name and contact information on our master list so that we can let you know when we're ready to go. And really is a community group effort, and we really appreciate all the volunteers who've let us know already they're willing to help out.
That's great. And I'm sure you'll have plenty of volunteers more. But the other big news this week locally is that the town supervisor of East Hampton, who I know you are familiar with, he has announced that he will seek another term in November. Can you imagine that he would? I mean, he hasn't had enough. He wants another term.
Yeah, so, I've had some friends contact me and say, "Are you kidding? Like, why would you put yourself in that position, especially now?" And I think that's exactly why I've decided to run again, because we're in the middle of this thing, and this is not a time to step back or give up or retire. And this is the time that we really need to push ahead. And I feel like I'm kind of uniquely positioned, being in the middle of this for quite a while now, and the learning curve is significant, and we have a lot of irons in the fire, and I want to make sure that we get many of these things done. We have a lot of work left to do, but job one right now is getting through the pandemic and the subsequent recovery. But at the same time, we know we need to move forward on a renewable energy front, on energy conservation, protecting our environment, preserving the local history, which is so important to us in terms of our identity and our heritage and culture. So there's plenty more to do here, Michael, and I'm honored to have served up to this date. And if the people of East Hampton are willing, I'm willing to serve another term.
That's great, Peter. Of course, I was kidding around. You take your job very seriously, and it shows. But can you take us through, Peter, for those of us who do not know, how does the process actually work? So you make an announcement real quick. We got 2 or 3 minutes here, but so you announce that you want to serve. So then take us through it. How does it work with?
Okay, so if you want to run for public office, you need to approach whatever party you're going to run with and let them know of your intentions. And they have a screening process where their committees screen candidates. Then if they select you, then you go through a nomination process. Once nominated, then petitions have to be circulated and signed and collected to meet a certain threshold of people signing on in support of you. Generally, if it's the Democratic Party, for instance, which I'm screening for, those petitions would have to be carried by registered Democrats to registered Democrats. Only the party members can vote in a primary.
Right.
If there are no challengers to the nomination, then there's no primary. If there is, then there would be a primary. Primary got moved up. Used to be in September. A couple of years ago, it got moved up to June, which pushed the whole process earlier. And with COVID, it's become even shorter and earlier. So, I think there will be a nominating convention in February, and there's only about 2 weeks to gather the necessary signatures. It makes it a little bit challenging, I think, during COVID. The time frame is shortened. The number of signatures required has also been shortened, but so is the time frame. So, that's basically it. And then whoever's on the ballot, goes on to the November election. And whoever wins that obviously takes office that following January.
And if you lose, you don't have to leave the office. Is this true? I'm just going by past.
I will commit to a peaceful transition of power right now.
Of course I can.
Yeah. I mean, again, I feel incredibly honored to have been elected repeatedly to public office, and that the community has the faith and confidence in me to serve, and I really appreciate that. And I guess we'll find out in this process if they still feel that way or not. It's kind of difficult in these times, being isolated, and you don't really have that one-to-one contact that you would normally in the community at different events and whatnot. Right. There's not always a lot of feedback. So I've tried to do the best I can. I've worked very hard on behalf of the community. I hope that shows, and I think we've achieved some great things. And I'm very fortunate to have had very supportive board members in Dave Lease, Kathy Burke-Gonzalez, Sylvia Overby. Those folks really have stepped up during the pandemic and taken on some really important committees, and whether it's human services or business recovery or getting the testing sites up. By the way, I think that testing site in Montauk will be coming. I've cleared the way with New York State Parks. Chip Gorman, there was a bit of a hiccup with being able to use the property near the boat ramp in Montauk, and thanks to the regional directors, direct help with me, we've cleared those hurdles, and I think we'll be ready to go soon.
Great news. Great news. Well, good luck to you, Peter, obviously, and we appreciate all you do, and we'll see you again next week, same time.
Thanks so much, Michael. You stay safe, be well. Take care, everybody.
Bye, everybody.